morning. This is CNN News. So today we're going to talk about coronavirus, which approach our government's taking. 2 months ago, China was the global epicenter of the coronavirus crisis. But as COVID-19, the disease caused by the virus, spread to become a global pandemic. The number of infections and deaths reported in China has slowed significantly. So, how did China get here? And other countries adopting its approach. China was initially slow to respond, but when it did, it moves were decisive on unprecedented scale. Beijing's drastic measure included locking down millions of people in Hubei province, and imposition of severe penalties for non-compliance. At the same time, the nation's industrial and manufacturing sectors were mobilized to produce medical equipment. South Korea was also badly affected by the virus, but the nation seems to have controlled its outbreak without following China's approach. Here's a quote from Kei Woo-jun, a infection disease specialist from Korea University.
South Korea is a democratic republic. We feel a lockdown is not a reasonable choice. Kim Woo-ju.
South Korea established an aggressive testing regime unmatched by any other country. The nation have tested more than 300,000 people so far, and they can now test 20,000 people a day. Tests combined with tracing patients' movements and contact, strict quarantine measure, and high-level public compliance seems to have worked so far. And yet, another approach was playing out in the UK British Prime Minister Boris Johnson early on moved on the country from containment phase to a so-called delayed phase.
Because this is now not just an attempt to contain the disease as far as possible, but to delay its spread and thereby minimize the suffering.
That meant the UK moved away from focusing on the early detection of the cases to instead trying to slow down the infection rates so healthcare workers could catch up. Controversially, Sir Patrick Balance, the government chief scientific advisor, suggested herd immunity as a preferred long-term approach.
And also allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response which would protect everybody.
The theory holds when enough infected people recovers and develop immunity and prevention. The risk falls, others who do not yet have immunity. But Balance admitted that in order to achieve this, 60% of the UK population would need to be infected. Imperial College London modeling indicated that such a managed spread could result in more than 250,000 deaths and overwhelm intensive care units. The government has now shifted an initial call for voluntary social distancing to what is essential a full lockdown that limits public movements to only essential activities. Outside mainland China, the most successful strategy appeared involved early action. In Taiwan, the authorities acted relatively swiftly, almost immediately doing contact tracing followed by social distancing. Italy, on the other hand, it seems a worst-case example, as the virus started spreading in the north part of the country. Central authorities were slow to act at first. Italy lockdown affected towns and regions. When they didn't work, leaders were forced to lock down the entire country. Social distancing rules are also placed. As similar to what happened in China, and Italian factories are closed for all non-essential production.
Look, we're in great shape compared to other places. We are in really good shape, and we want to keep it that way. That's why I did the ban.
The United States has adopted a more varied approach, involving things like travel bans and social distancing. But individual states are implementing their own measure independent of the federal government. California has imposed a lockdown. In New York, the National Guard has helped establish a 1-mile containment zone around an original cluster site in town of New Rochelle. But at federal level, the response continued to be criticized as too slow when it comes to the effective centralized contract tracing, ensuring inadequate supplies of equipment, and widening testing capacity. Lastly, there's Iran. Tehran has implemented a number of measures, including testing capacity, closing educational institutions, enforcing social distancing, and trying to limit internal movement. But the country still does not have the testing of contract tracing capabilities of nations like South Korea. And the virus is still spreading and death increasing globally. Iran and many other nations are scrambling to figure out the best way to deal with the crisis. The stakes are higher and the pandemic is still rapidly taking lives in overwhelming healthcare system and economies around the world.